it's Dr. Tlaleng again, and I'm going to give you some tips on how to cope with the ups and downs of living with HIV. It may be quite scary in the beginning when you get the diagnosis of HIV. However, this has become one of those chronic illnesses that can be managed. Some of the things that you can do while you're trying to cope with HIV is to eat a healthy, balanced diet, avoid smoking and avoid alcohol consumption, treat any sexually transmitted infections that you may currently have. This is very important because once you have the diagnosis of HIV, it's important to then follow up on your blood tests. You have to do your monthly, sometimes it's 6 monthly blood levels, so that we know how HIV is affecting your body and if anything needs to be done in terms of your treatment. Once you start the antiretroviral therapy, it's very important to adhere to the treatment schedule and be aware of the possible side effects that you may have. In the case that you do suffer any of these side effects or any adverse effects, you then have to speak to your nurse or your healthcare provider. One thing else that we need to remember around HIV is that you can still have a fulfilling sex life, but you need to be careful and speak to your partner and be open as much as you can about your diagnosis, so that they too can then take the necessary precautions to try and lessen their risk of getting HIV. We can use a female condom, the male condom, or dental dams for when we're giving oral sex. It's very important as well when it comes to HIV to understand that no 2 days are the same. You may feel up and you may feel down. And it is okay to feel down sometimes. What I can say is speak to a friend, speak to someone you trust, even consult with your healthcare provider. They have tools and they have ways in which they can assist you. I know you've heard it before, but I'm going to say it again. It is absolutely possible to lead a healthy life and a fulfilling life with HIV.